use a cannula if I have to do a long run, but I could eventually do that with some boluses too. Again, a conservative amount of material distributed to the very deep part on the bone and the frontal part, or the where I reach the cheek apex point, and then I go fan out and like contouring again with a makeup, with a blush. I go lateral upwards. Combining that all means that, well, that's what you see typically on these courses. Speakers tell you, this is my recipe, and then they do a totally different story on stage. So that might happen to me too, but I'm basically techniques should be based on a theoretical, a GPS. Again, we should know what we're all doing, and I do pretty much start with the same actions, and then I adapt. I customize the treatment. So looking at, was a workshop model done on a congress for her cheeks and nasolabial folds, a lifting, recontouring of her cheek directly after. It does not really swell. You see the whole area is a bit reddish. That's why, because we clean up the skin, we touch the skin, we do work with these patients' anatomies, but it does not swell. I never had a swell next morning, certainly not in the superficial indications. That's a frontal view. And this is again our patient. I did put you on the screen. Look at that. She had subcutis 1.5 cc on her cheeks. That's immediate after the show last year, and the nasolabials, as well as the oral commissure, the marionette line, and I used obviously bolus and needle and kind of technique for that. That's a lady of myself in Munich. So to summarize, Liquidimplant is a very safe and effective substance. As you saw, it does last really long, gives nice results, and patient are happy. So is she, obviously, otherwise she wouldn't not have come back, I guess. Thanks for coming. Yep. So let's get started here. I brought all the little stuff with me. We need you to sit up, please. Could we move the tape? No, we can't.
Yeah, I think it's
you can?
maximum. Of course. Strong enough. Like where?
No. Up. No. Up. And I need to have the screen just wherever I can see it.
Where you want?
Like that?
This would be complicated.
Wherever you can, but I need to see it.
I can move the table if you want. Like this?
Okay, no, then leave it as is. Thank you. Could you sit up and look to the camera, please? So, I already disinfected, but maybe one more. So today, looking at her in an analytical way, she obviously shows a bit of a nasolabial folds, and going like that. This is a typical test I do with my patients in the clinic, and try whether I could affect something once I'd lift her with my finger, the lateral over the here. So basically, I think she'll profit of, and this is something I test from the upside down. She starts to groove on her mailer here. So I will do that. Looking at her, that's always a bit difficult to see. She starts to get the overexposure of the fat pads here, so I might redefine the mandible angle. Same on the other side, I guess. But what I will certainly do, looking at the cheek again, she has some hyperpigmentation here, which makes the junction show far more. So she would profit on a tear trough treatment, I think, so I will do that today too. Okay, so let's get started. Thank you, Olga, for helping me. Could you just relax and lay back? And lower your chin a bit. Is that possible? Thank you. So what I did is I brought Cutis with me. Cutis is a highly viscous, long-lasting hyaluronic acid and can be injected with a 27, sometimes I use 25 sharp needle. So what I do is I'll give her, well, about the markings, I don't know whether you want to see that again, but I do always palpate the orbital rim. So the lateral is border is here, and where this line crosses the line from mid-mentum, this is the point where the material should be, as this is the highest point of the cheek. And looking at the material, it is as elastic as you can see. It stays there. So are you ready with the camera? I will give her, ouch, one little bolus. There's a huge discussion on aspiration or not. I think it's pretty difficult to aspirate, but routinely we will give it a try. I put 0.1 here. You know what? Now I'm already doing something different from what I was talking to you. So to put the second point into place, I simply stay in with my needle. That avoids another entry point, and I give her another 0.1 here down to the bone. Okay. It is a lot about avoiding entry points, avoiding trauma, avoiding running around with needles or cannulas in the tissues. Second, is more medial. That's the banana wise. Injection, another 0.1. And the third one is the one on the upper part of the nasolabial fold. I do touch the bone, but very carefully, because otherwise my needle gets unsharp. And I put another 0.1. Next point will be the one to give a little support to the marionette line. She doesn't need a lot this year. There's still some subcutis in. And the next one today, this year, will be a bit different. It's the one where the mandible ligament sits to take away this little groove. That's an area which might bruise. And you can't do a lot about that, but being careful in injection. Okay, now my check is to look upside down, and she obviously needs a lateral lift. Can you turn around, please? You can't see that. There's a groove. Can you see that? Yeah, I think it's okay on the camera, so I will give her. And this is different to the approach with the cannula. It's pretty much the same entry point, but it's just a little 0.1 of the material. And same with more lateral to this. I could have used the other entry point, sorry for that. And I would love to have that checked. Now you can name all these points. You might have seen Mauricio de Mayo yesterday. There's a lot of